This morning, the UC Gardner Neuroscience Institute is home to the region's most experienced neurosurgery team. From routine to complex brain and spine care, convenient neurosurgical services are offered right here in the tri-state. And Dr. Joseph Cheng tells us more.
The neurosurgery program here at the University of Cincinnati Gardner Neuroscience Institute is really the only academic program in our region. We not only treat the bread and butter of neurosurgery problems, but we also are able to take care of the more complex and really be innovative, whether it's the brain with brain tumors, aneurysm ruptures, strokes, spinal cord tumors, degenerative spine disease, and low back pain, to peripheral nerve problems like carpal tunnel syndrome or problems with the ulnar nerve in your elbow. Also the more complex care, patients with different medical issues that make them a high-risk candidate for surgery that we can take care of here, to really cutting edge things like laser interstitial therapy and other modalities of treatment such as minimally invasive surgery and even non-invasive type of surgical options. Patients can receive neurosurgical services at many of our sites within the University of Cincinnati Gardner Neuroscience Institute, everywhere from northern Kentucky at our Florence clinic to our Westchester clinic to really as far north as Dayton, where we actually have a clinic for both neurosurgery and neurology, along with here at our Clifton campus in the greater Cincinnati downtown region. This is really the leading institution for neurosurgery. If you think about what we do, we actually are the ones that are authoring the papers, doing the research, writing the textbooks that many of our colleagues are using to help them in their patient care. What sets the UCGNI apart for neurosurgery and really neurosciences in general is really the robust clinical trials that we actually coordinate through our system. So for example, our comprehensive stroke care with StrokeNet really not only covers the region for medical management of stroke, but really endovascular and surgical options as well. The multidisciplinary care team benefits our patients by really focusing on treating the disease versus providing a service. It's not the same as if you just go to see different doctors in the same area. Really, one of the differences that we have here within our system, with our institution, is really the ability to coordinate all these services. It's almost like if you're trying to build a house. Absolutely, you can hire your own electrician, your own plumber, your own carpenter. But really what you need is a contractor that's able to put that all together and put that into a team so it's focused on building the right house for you. We are actually one of the few places with a dedicated neurotraumatologist, that is a neurotrauma neurosurgeon. We have subspecialists here in all of the disciplines. It's similar to if you have diabetes. Sure, you can go to your internist or family doctor to take care of it, but that's different than seeing an endocrinologist. And within neurosurgery, that's what we provide, is that subspecialty of neurosurgery to really take care of the more complex problems. The care provided by our neurosurgery team provides hope to patients by really treating every patient as a family member or a loved one. We would never offer treatments that we wouldn't either have ourselves or someone in our family. This is one of the reasons why coming here can really give patients the best option and really the best hope possible for getting better.
And for more information about the University of Cincinnati Gardner Neuroscience Institute, call 513-475-8990.